Good morning, everyone. I'm Sun Hu from Department of Rheumatology, the first hospital of China Medical University. Today we will talking about the systemic lupus erythematosus. In briefly, we can call it SRE or lupus. And today we will mainly talking about the clinical manifestation for lupus. As lupus onset, it may involve one or several organ systems. Over time during the period, additional manifestations may occur, and most of the antibodies characteristic for each person are present at the time for the clinical manifestations appear. And the severity of lupus may vary from mild and intermittent to severe, and sometimes the lupus may be life-threatening. So from this figure, we can show that lupus can involve all the organs and the systems of the patients. We will see one by one. The first is the systemic manifestations. Nearly 95% of patients may have the systemic manifestations. The systemic manifestations may including the fatigue, malaise, fever, anorexia, and weight loss. And fatigue usually may be the first complaint for the patients to the clinic to see the doctor. And the fever for the lupus patients usually is mild, not very severe. If the patients got a very high temperature, we must pay attention to whether the patients got an infection except the lupus. Next, clinical manifestations is the skin and the mucosa. About 80 to 90% of the lupus patients may have the cutaneous and the mucosal manifestations. This including the photosensitivity, the malarise, the oral ulcers, the alopecia, discolored rash, and the vasculitis rash. The photosensitivity means the patients sensitive to ultraviolet rays, and some of the lupus patients may got flare due to the exposure to the ultraviolet rays. The malarise is the typical skin rash for the lupus patients. The malarise looks like a slightly raised erythema, and around the erythema occasionally is scaly and always is on the face. Particularly the skin rash, the malarise, is located at the cheek and the nose. And the seam of the skin rash look like a butterfly. And the wings of the butterfly is located at the cheeks. And the body of the butterfly is located at the nose. So the malarise, the butterfly rash, is a typical skin rash for the lupus patients. And another typical skin rash for the lupus patients is discolored rash. Just as the name, the discolored rash is a roughly circular shaped, and is also slightly raised, scaly, hyperpigmented around the rash. And in the center of the rash really is depigmented and atrophic. All the dermal appendages are destroyed permanently. And the discolored rash can locate it on the face and also can locate it on the scalp. Oral ulcers is also a quite common manifestation for lupus patients. And the oral ulcers usually located at the mouth, the mucosa of the mouth. It may be occur one or maybe occur several. The alopecia is also quite common in lupus patients. But the hair for the lupus patients is usually weird and yellow, so it's quite typical alopecia for lupus patients. Next, we will look at musculoskeletal manifestations. Nearly 100%, 95% of lupus patients may have the musculoskeletal manifestation. The common for this manifestation are the arthralgias and the myalgias, is 95%. And 60% of lupus patients may have the non-erosive polyarthritis. 10% of patients may have hand deformities. And near 1/4 patients may have myopathy or typical myositis. About 15% of the lupus patients may have ischemic necrosis of the bone. But ischemic necrosis of the bone, we must pay attention to whether it's induced by the lupus itself or it is induced by the use of the drug therapy. Such kind of glucosteroids can induce the ischemic necrosis of bone. The arthritis, most of the lupus patients may have the intermittent polyarthritis, and the degree of arthritis may vary from mild to disabling. It's characterized by the soft tissue swelling and the tenderness in joints, and most commonly in the hands, in the wrists, and the knees. About 10% of the patients may got the joint deformities in the hands and in the feet. Although the erosions by the X-ray scan are rare, but at this moment today, some experts think that erosions really can occur in some lupus patients. The myositis. The myositis means that the muscle weakness or the pain of the muscle in the lupus patients. And by the laboratory test, we can see the elevated CK levels. And by the MRI scan, we can see the positive inflammatory signals. And if we do the muscle biopsy, we can see the muscle necrosis and the inflammation. For the myositis for the lupus patients, we must pay attention to some drug therapy, such as the glucosteroids, such as the anti-malaria therapies, really can induce the myositis in lupus patients. But the drug-induced myositis may decrease when the drug tapered. So we must pay attention to differentiate from the myositis of lupus or from the drug therapy. Let's look at the renal manifestations. Nearly half to 90% of the lupus patients may got renal manifestations. The clinical manifestations for the renal is proteinuria or hematuriria. Some of the patients we can see the cellular cyst. The proteinuria means that it's smaller than 500 milligrams per 24 hours urine. About 1/4 of the lupus patients may have the nephrotic syndrome, and nearly 10% of lupus patients may get the end-stage renal disease, ESRD. The lupus nephritis is usually the most serious manifestation for lupus. And the nephritis and the infection usually are the leading cause for the mortality in the first decade of the disease. In the clinic, the renal biopsy is useful in planning the current therapy and in the prognosis for the lupus patients. For the kidney biopsy, it can be the nephrosis divided into 6 classes. Class 1 is normal. Class 2 is mesangial glomerulonephritis. And class 3 and class 4 is the proliferatory glomerulonephritis. Class 5 is the membranous glomerulonephritis. And class 6 is the end stage of nephritis, is sclerosing glomerulonephritis. And the patients with proliferatory forms of glomerular damage, such as class 3 and class 4, usually have hematuria and proteinuria in the clinic. If the diffuse proliferatory glomerulonephritis is untreated, and the patients, almost all the patients, can develop end-stage renal disease, ESRD, within 2 years of diagnosis. For the class 5 membranous glomerular damage, the outcome is better than that of the proliferatory forms of the damage. We will look at the nervous system manifestations. About 60% of lupus patients may have the neurologic symptoms. We call it neuropsychiatric SRE, NPSRE. And the clinical manifestation for NPSRE is very complicated. It may include the cognitive disorder and the mood disorder. That means that difficulties with memories and reasonings for the patients. And some mild NPSRE may look like a headache, and some severe NPSRE symptoms may include the seizures and the neuropathy, and also the stroke or the acute confusion state or movement disorder. And this may be due to the vasculitides of such kind of patients. The neurologic clinical manifestation, including the central nervous system and the peripheral nervous system manifestations, is the major cause of morbidity and mortality for lupus patients, just like the infection and the nephritis. The NPSRE is also the major cause for morbidity and mortality of lupus patients. And the symptoms may different from lupus or from some other conditions, such as the infections, because lupus patients were treated with the cytotoxic drugs, with the corticosteroids. Some of the lupus patients may, in the immune suppressed conditions, can induce the infection, and infection can also cause the neurologic symptoms of lupus patients. And also the psychotic must be decreased from the glucocorticoid-induced psychosis. We know that the high doses of glucocorticoid therapy can induce the psychosis in the clinic, especially if doses is higher than 40 milligrams per day. And the symptoms usually occurs in the first week of the drug therapy. And the symptoms may become recover for the dosage of the drugs taper. The neurologic symptoms may include the emotional abnormal and the vasculitis. Emotional abnormal may be associated with the ribosomal P antibody positive, and the vasculitis, including the bleeding, thrombosis, may be associated with anti-cardiolipin antibodies positive. And the cerebrospinal fluid, there's no special change for the cerebrospinal fluid of lupus patients. We can see a slightly increase in intracranial pressure, a slightly increase in protein and the cell population, a slightly decrease of glucose. But the lumbar puncture may help us to identify the NPSRE with other central nervous system diseases, such as the infection. Because in the infection of central nervous system, the cerebrospinal fluid can see the significantly increase of protein of cell population and the significantly increase in the intracranial pressure. So it may help us to identify with NPSRE and the infection of CNS. The pulmonary manifestations. The most common clinical manifestation for pulmonary in lupus patients are the pleurisy and the pleural effusion. The pleurisy means the inflammation of pleura, and the pleural effusion means the fluid in the space between the two layers of the pleura. And also lupus pneumonia and the pulmonary interstitial fibrosis can be occurred in the lupus patients. Some life-threatening clinical manifestations for pulmonary lupus patients are diffuse alveolar hemorrhage. It's really a life-threatening symptoms of lupus patients because it has a very high mortality. And also at the end of the stage, the patient may go with respiratory failure and pulmonary hypertension. For the cardiac manifestations, the pericarditis is the most common cardiac manifestations. And there's still some more severe cardiac manifestations, such as the myocarditis and fibrinous endocarditis. The endocardial involvement can lead to the valvular insufficiencies or to the embotic event. And also the myocardial infection usually is due to the atherosclerosis of the coronary artery. Sometimes the myocardial infection may be the first onset clinical manifestations for some lupus patients. The gastrointestinal manifestations. Nearly 40% of lupus patients may have the gastrointestinal symptoms in the clinic. The most common are nausea, vomiting, and diarrhea. The diffuse abnormal pain may be caused by the autoimmune peritonitis or by the intestinal vasculitis. And also the abnormal liver enzymes can be seen in lupus patients. The vasculitis involving the intestine may be the life-threatening, and preference, ischemia, bleeding, and sepsis are usually frequent complications for lupus patients, and also is life-threatening. One special symptoms, we call it protein-losing enteropathy. It rarely occurs in lupus patients, but it really do occur in lupus patients. We can see some in several in clinic, because the protein-losing enteropathy can cause the injectable hypoproteinemia. Hematologic manifestations. About 85% of lupus patients may have hematologic symptoms. The lupus can affect all the cell types of the blood, including the white blood cells, the red blood cells, and the platelets. The most common hematologic symptoms of lupus is anemia. The anemia may be due to the chronic disease or due to the hemolysis. The hemolysis may cause severe anemia, and it can be rapid in onset, and it can be very severe and life-threatening. Leukopenia and lymphopenia is also common in the lupus patients, but the leukopenia and lymphopenia usually is not very severe and not very low for the numbers of the cells. And the thrombocytopenia, lupus patients, sometimes the number of the platelets can decrease significantly. We really see some lupus patients, the number of the platelets is nearly to zero. But such kind of patients, they really have the bleeding, so it's quite strange. So the platelet, if the platelet number is higher than 40,000 and the abnormal bleeding is absent, usually the therapy may not be required. Ocular manifestations. About 50% of lupus patients may have ocular symptoms. The common one is the Seeger syndrome and the nonspecific conjunctivitis. And it's in lupus patients, such kind of syndromes is really life-threatening and is not threatening the vision. But the retinal vasculitis and the optic neuritis are serious manifestations because it can cause the blindness, and it can be developed very fast over days to weeks. And also due to the vasculitis, the retinal artery or vein occlusion may occur. There are two syndromes may are combined with the lupus patients. One is antiphospholipid antibody syndrome. Briefly, we call it APS. The typical clinical manifestation for APS is first vascular thrombosis. This vascular thrombosis may include artery, venous, or small vessels. The second clinical manifestation for APS is pregnancy morbidity. The patients may get the spontaneous abortion. And by the blood test, we can see the anti-cardiolipin antibody positive. Another syndrome is Sjogren syndrome. Nearly 30% of lupus patients may get the Sjogren syndrome at the same time. And the clinical manifestation is the dry of the eyes, dry of the mouth. And by the biopsy, we can see the lymphocytes infiltrated to the lymphcriminal and the salvular gland. And by the blood test, we can see SSA and SSB antibody positive. That's all the clinical manifestations for lupus patients. Thank you very much.